I now recognize Ranking Member Stark for 5 minutes for the purpose of his opening statement.
Thank you, Mr. Chairman, for holding this hearing today to try and explore how the private sector payers are rewarding physicians who deliver high quality and efficient care. This continues discussions we began, I guess, last May to review innovative delivery and payment system reform efforts. I agree with you, Mr. Chairman, that it's important to hear from the private sector, but I also would note that we are only 3 weeks away from a 27% cut in Medicare physician payments. We keep avoiding the topic of sustainable growth rate formulas in favor of the easier conversations about delivery system reforms around which we have much stronger agreement. If we don't fix Medicare's physician payment formula, we're going to lose the ability to collaborate with the private sector because the physicians will abandon Medicare. We all share the blame here. I'd like to blame it all on the Republicans, but I can't. We're more than a decade away into the debacle known as SGR reform. We've known this hasn't worked for many years, but neither side has been able or willing to come together to enact a permanent solution. And the biggest reason is the cost. The way the formula was designed, we'd have over $300 billion to correct the formula. We have an opportunity. Members on both sides of the aisle and Capitol are agreeing to more members are agreeing to the idea of using the war spending, overseas contingency operations it's called, as a financing mechanism to pay off the SGR problem. Without objection, I'd like to make part of the record a letter signed by most of America's physician professional societies in support of this.
Without objection.
Thank you, Mr. Chairman. I'm encouraged by this conversation, and I'm curious to hear from our witnesses today. And I think most of them will agree that SGR reform is the #1 issue facing physicians. We've got to get this issue behind us, and then we'll be able better to devote our attention to implementing reforms as discussed at today's hearings. I'd like to note also that to look at purely private sector efforts is not exactly the answer. Mr. Nichols, I think, will highlight the synergy between government initiatives to change payments to promote quality efficiency and their private sector counterparts. Though many of my more conservative colleagues are loath to hear this, the new health reform law is promoting public-private initiatives to incentivize high-quality, efficient care. Examples like the challenge grants through the new Center for Medicare and Medicaid Innovation, accountable care organizations, bundled payment initiatives are all public-private partnerships, and they're moving ahead. Their impact goes beyond Medicare, and we're testing models we want to spread across payers. So I'm excited about the synergy that we're seeing between the private sector and government, and I look forward to hearing from today's witnesses and hope we can discover new opportunities for collaboration. Thanks very much.
Thank you. Today we're joined by 5 witnesses